Jessica Voss, and this is my journal number 4, my last journal. Today we're assessing a 24-year-old female for musculoskeletal system and also neurological system. Okay, so the first thing I'm going to have you do, if you don't mind, I'm just going to have you walk across the floor. Let me get out of here. Okay, so just walk across the floor, and I'm looking for any gait abnormalities. So you keep going. No, it's okay. And then come back. So the gait is symmetrical. There's no issues there with the gait. Posture is symmetrical. She's not leaning to one side, anything like that. I'm not going to have her take her clothes off, but range of motion seems appropriate in all extremities. As you can see, the ability to stand is without hindrance. And then if you wouldn't mind turning your back for me. Yeah, and then if you could bend over just a little bit, and then back up, and then towards me. Sorry, I have a mobility issue, so it's hard to walk around. So sorry if I'm like weird in the video, but okay, come towards me, and then turn around. Okay, so we're looking at the spine here, and there's no curvature of the spine, and there's no lordosis or kyphosis noted. And then if you want to turn around here for me, there's no skin lesions. I've checked her in previous videos. And then as far as muscles, there's no hypertrophy or atrophy in any of the muscles. As you can see, the tone is appropriate. Also here. Yeah, the muscle tone's appropriate. And then the back. Just going to feel here. All muscle tone is symmetrical. Nothing abnormal there. And then I can see in the legs also it's the same. Okay, so I'm going to have the patient sit. We're just going to take a look real quick at the bones and the joints. I feel so dumb doing this in a video. Oh, it's better than the chair, though. It's true. Okay, so we're just going to do real quick, like a really quick assessment of the bones and joints, even though we're going to go back over them. Okay, so I'm just going to have her bend her arms. Okay, and can you bend your fingers for me? In and out. Yeah, perfect. And the other one. Okay, go in. Palm up, yeah. And then in and out. Yeah, that's okay. And then fingers. Okay, great. And then your knees as well. You just flex and extend. And then your toes as well. Good, and then we already kind of saw her relax. We already saw the back, but there's no inflammation, no crepitus, nothing like that noted at any of the joints, full range of motion. And then we're going to do just some resistance to pressure, and then we'll look at the jaw. So we're going to do the same thing, but I'm going to apply pressure. So if you could just bend your arm. Okay, do it again. Okay, and then the other one. Okay, and then the knees as well. Okay, bend up. Up, yeah, okay, perfect. And then up, and then down. Okay, so she has proper resistance to pressure. Okay, so now we're going to be looking for TMJ. If you could just open and close your jaw. Perfect. And then if you could do it with pressure. Okay, perfect. There's no crepitus. The jaw is moved laterally. And then we're going to see if she can you like put your teeth out like this and then in. Perfect. And then can you clench your teeth? Perfect. Okay, and then I'm going to have her stand up. We're going to look at your posterior neck and your cervical spine, so you can turn that way. Also the trapezius. Okay, so the cervical spine and the upper thoracic spine is all symmetrical. The trapezius is symmetrical as well. We're going to check, go ahead and stand this way. We're going to have you do a couple of things to just check the range of motion in your jaw. So if you could put your chin to your chest and to the ceiling. Okay, good, back down. Ear to both shoulders. Okay, and chin to both shoulders. Sorry, I don't get really close. Okay, and then opposing force, so look straight ahead. Okay, now put your head towards me. Yeah, okay, the other way. Okay, so proper resistance, no abnormalities of range of motion. Okay, we already checked the posterior neck and the curvature of the back. We already checked the trapezius. Spinal process and paravertebral muscles were all symmetrical, no abnormalities, no pain back there. And then so if you want to just turn that way for me. How is this hard? I don't know my fingers. Okay, we're going to just do, oh, that might be good. We're going to do some fist percussion at the back. Let me know if you feel any pain here. All the muscles around the spine are symmetrical. And there's no pain there. No pain there, right? Mm-hmm. Okay, good. No, it's okay. Okay, so now I'm just going to do some more range of motion. I'm just going to have you touch your toes, please. Okay, and then back up. And then if you could hyperextend, so go backwards at the waist. And then to side, each of your sides. Good, and then twist your trunk. Good, no abnormalities there. No hindrances with range of motion. Okay, so we already kind of looked at the the shoulders. They're symmetrical. There's no wing scapula here at all. The muscles are symmetrical. And then we look at the front. We're going to be looking at the joints, the sternoclavicular joint, acromioclavicular joint, clavicle, and the scapula. So I'm not really going to pull down your shirt, but oh great.
I'll get them.
It's okay. I can feel you're symmetrical here. No abnormalities with the joints, no asymmetrical or masses or anything noted. And the shoulder joints feel okay. I already kind of felt in the back. Okay.
Sorry. Oh, great.
It'll be all out of order. Oh no, actually we're good. Okay, so now I'm going to have you shrug your shoulders up and down. Okay, I'm going to do it with resistance as well. Okay, perfect. And then we already kind of did this, but I'm going to have you flex your arms and then hyperextend, go back as far as you can. Okay, that's appropriate. And then abduct and adduct. Yeah, perfect. And then if you could rotate them in and out, hold them straight out. Yeah, and then in and out. Yeah, perfect. Okay, with elbows, if you could just rest them, just like normal, how you'd be at rest. Okay, there's no abnormalities there. There's no cubitus valgus or varus. The carrying angle is about, do it again. And I'd say maybe 15 degrees, maybe a little less. Okay, we can relax. Okay, so now we're just going to palpate the elbows. Okay, just palpating the joints, both sides of the ulna, the condyles, and the acromion process. There's no abnormalities there. They seem symmetrical. There's no masses or anything. Okay, and then go up and down for me at your elbows. And then if you could let me see your elbows. Yeah. We'll see what it's like flexed. Yep, no abnormalities. They're symmetrical. Okay, thanks. You can relax. We already kind of did range of motion of the elbows. Okay, and I'm going to look here just at your hands. And we're going to check for symmetry. There's no abnormalities with symmetry here. Okay, they look good. And can you just open and close your fingers? Okay, they look good. No redness, nothing like that there. We're going to look, well, I already did look, but there's no any kind of nodes there, no Herberdin or Bouchard nodes. The radiocarpal groove is appropriate. I'm going to check the other one. Yeah, there's no nodes or anything, no signs of arthritis, stiffness, or anything. Okay, you can relax. And then we already did the flexion and extension of the fingers. Okay, so I'm going to have you touch your thumb to each fingertip. Okay, great. And then I'm going to have you spread them together and then bring them back in and make a fist. And then if you could extend all the way and then back and then turn them in and out. Yeah, perfect. Okay, and I believe that's about it. And I'm going to have you squeeze both of my fingers as tight as you can. Okay, thank you. Patient has full strength bilaterally. And then we're going to look at the hips. Already you can kind of see, I feel like come towards me. The hips are symmetrical. There's no abnormalities with either of the hips. The crest is prominent. There's no issues there. Okay, so I'm going to take a step back. I'm going to have you, let me get out of your way. If you could just bend forward for me at the hips. Yeah, perfect. And then all the way back. Yeah. Okay, and then there's no issues with the hips or pelvis. We had her flex. Oh, and then if you could go as far back as you can. Yeah, perfect. That's fine. She was able to hit that 30 degrees. And then if you can get your knee to your chest as far as possible. Okay, and then the other side. Yeah, perfect. Thanks. And then if you could bring your leg outwards to the side and then back. Yeah, and then out. Perfect. She could hit that 45 degrees, just perfect. And then if you could rotate your legs inwards one at a time. Yeah, oh, that's fine. Perfect. Okay. So now we're going to look at the knee. If you could just sit. Oh, my water bottles. Wait. Okay, so if you could just extend and relax your knees. Yeah, perfect. Okay, and then we're looking at the condyles here of the femur. and the tibial ones. Okay, they're symmetrical. There are no issues there. The patella are both symmetrical. There are no issues there. And when she stood, we saw that there was no knock knees, bow legs, or hyperextension of the knee. Nothing abnormal there. The popliteal space was normal. I just kind of felt it. Tibiofemoral joint was normal. Suprapatellar pouch, anteropatellar fat pad, those are all normal. There's no like bursa noted, no asymmetry, no crepitus when she flexed. There's no ballotment and no bulge sign. And then if you could just, we already had her flex and extend. The feet both appear symmetrical as well as the ankles. So I'm going to feel the inside and the outside here. The medial and both lateral malleus are both symmetrical. The Achilles tendon, sorry, I know you can't really see this in the video, but the Achilles tendon are symmetrical. There's no tenderness there or anything like that. She has 10 toes on both fingers, no abnormalities with the toes. No pes varus, valgus, or planus. No pes cavus as well. Longitudinal arch. Yeah. Longitudinal arch is appropriate as well. There's no hammer toe, no claw toe, no hallux vagus, no bursa, no tenderness, anything like that noted at that side. Got it, yeah. No issues with Achilles tendon. NTP joints are all normal. So I'm going to have you point your toes up and down for me as much as you can. Yeah, that's perfect. Yeah. Okay, so plantar flexion and dorsiflexion are normal. Thank you. And then if you could turn your toes inwards and outwards as best you can. Perfect. She had that 30 degrees, not 20 degrees. Fine. And then abduction and adduction was great as well. And then if you could just bend your toes and relax. Okay. And then the patient did say that she does have plantar fasciitis as well as bunion on, is it both feet or just one?
Yeah, both.
Let me see. I can see.
Is that both? Isn't it?
The bunion?
Yeah.
Oh.
I'm sorry, are you recording this?
Yeah.
Okay.
Patient has slight bunions on both feet as well as plantar fasciitis, but you can't see that at this time. And we'll come back to measurements. Okay, so I'm going to have patient, now we're going to move on to the neurological exam. Do you have any issues with smelling?
No.
Or with smell? Can you breathe in and out through your nose, okay?
Yes.
Okay, perfect. And then go ahead and stare straight ahead. And tell me when you can't see my finger anymore.
Got
it. Okay, so about right here.
Got it.
Okay, so they're about symmetrical. She has full visual fields. We're not going to do the light reflex exam at this time. Oh, I do have, where's my light?
It's in your pocket.
Oh, thanks. Okay, go ahead and stare straight ahead. And I'm just looking at parallel real quick here. Okay, pupils are round and reactive, maybe about 3 to 2 millimeters, so that's appropriate. The jaw muscles were symmetrical. We observed her chewing earlier, full range of motion there. The nasal labial folds here, as you can see, are symmetrical, both sides. No issues with that. I'm going to have you raise your eyebrows and put them down, and then squeeze your eyes shut, and then wrinkle your forehead. You know, that would be at the same time. That's okay. And then she's smiling, cute frown. Yeah. And then show your teeth, and then purse your lips. Perfect. And then puff out your cheeks. And then if you could say BMP.
BMP.
Okay, perfect. And if you could turn that way, I'm going to whisper something into her ear and then see if she can hear equally on both sides. So just say
372.
Okay, and then the other way. Thanks for turning for me.
419.
Okay, perfect. So hearing's bilaterally strong. No issues with hearing. There are no issues with swallowing. We're going to look at the uvula and the soft palate. So we can just open and look up just a little bit. Okay, stick out your tongue for me. Can you literally say ah? Yeah, perfect. Your uvula is kind of pointy. It's like kind of pointy. I don't know if that means anything. But
Uh-oh.
the soft palate's appropriate. We had her shrug her shoulders and turn her head. Fine. Okay, so now we're just going to test your tongue. If you could just push against each cheek with your tongue. Yeah, on the other side. Perfect. Swallowing. Maybe I'll, if you could just raise your neck up like this and have you swallow. Yeah, perfect. No issue swallowing. And if you could say LTDN.
LTDN.
Perfect. Okay, so now we're going to do just a couple coordination exercises. I'm going to have you pat both knees, alternating hands for just a second.
Like this?
Well, yeah, you can just do like one at a time or
Oh.
whatever. Yeah, okay, so then the other one. Yeah, perfect. Okay, then we already did touch thumb to each finger. If you could tap my hand with one finger. Yeah, perfect. And then the other one. And then touch nose with your index finger. Okay, other one. And this is you're supposed to touch my nose. Good job. No issues with range of motion there. So I'm going to have you hold your hands straight out in front for a second. And then as you can see, there's no pronator drift. Okay, thank you. And then if you could put your heels, you could stand and put your heels on your shins.
My heels on my shin.
Yep. Yep, and then the other one. Perfect. Okay, then stand just straight. Put your feet together. And we're doing the Romberg test now, looking for any excessive swaying. As you can see, that's not noted. And if you could close your eyes. And then she's able to stay still, right at balance, so that's negative Romberg. And then if you could you can open your eyes. If you could just stand on one foot and then on the other foot. Perfect, we already had her walk. Could you do a heel to toe walk? Yeah. Perfect. That's fine. That's perfect. And then could you walk just on your toes? Take a couple steps. Okay. And then if you could walk on your heels. Perfect. She's good. Okay. We already did hand grasps. There's no pain. We're not going to do vibratory sensation right now because I don't have the proper equipment or temperature. Stereogenesis. Okay, if you could sit, we're just going to look at your 2-point discrimination. So go ahead and close your eyes. I want you to tell me if I'm touching you on one side or both sides of your body. Okay? And tell me where.
My left hand.
Okay.
Both cheeks.
Okay.
Both legs.
Okay.
Right forehead.
Okay.
Left foot. Both knees.
Okay, perfect. So she has proper 2-point discrimination. If you could hold out your palms, I'm gonna write a number. If you could close your eyes and then tell me what the number is.
3.
5?
5?
Yeah. Okay.
Again. What was
That
that?
was easy. That was a 7.
Oh! I'm like a Z?
Okay, another one.
2.
Okay, good. Okay, so that's appropriate. And then right now we're just not really going to do reflexes because I don't have the little hammer thing, but we have no reason really to believe that there are any reflex abnormalities at this time. And then I am going to do, we are going to check for clonus though because I can do that with the hammer. So if you could just relax your knees. Sorry, let me get in a good position. Okay, so I'm just going to bend your foot up and down. And then hold it up and check for any, what do you call them? I don't know how you call it, but it's when you like pump your foot, okay? So go ahead and just relax. Okay, there's no clonus on the left foot. Okay, and no clonus reflexes noted on either foot. So that concludes this little journal and all the journals ever. So.